Hi Nancy, my name's Janet. Thanks for coming in today. I'm going to ask you a few questions about your assessment and intake process, okay?
Mm-hmm.
I see that you've completed your consent forms. Do you have any questions for me?
No.
Would you prefer that I call you Nancy or Miss Hall?
Nancy's fine.
Okay. Do you understand why you're here?
Yes.
Have you ever been in treatment or counseling before?
Yes.
I'm just going to go ahead and type. That'll save us some time if I just type in the answers as we're talking.
Okay.
Are you currently employed?
Yes.
And for how long?
30 years.
30 years. What's your highest level of education?
Bachelor's degree in nursing.
Okay. Do you have any general concerns about being here?
I want my job to know.
Okay. Well, everything that we do here is completely confidential, okay? Are you married?
Yes.
Do you have any children?
Yes.
And who do you live with?
My husband, my children.
Okay. Are your parents still living?
Yes.
Do you have a pretty good support system?
Yes.
Do you have any current medical conditions?
I have asthma, high blood pressure, and diabetes.
Have you had surgery in the past 6 months?
I have my gallbladder out. That's all.
Are you currently being treated by a doctor?
Yes.
Do you take medication?
Yes.
And when was the last time that you saw your family doctor?
November.
November? I'm going to ask you a series of questions about chemical and drug use, okay?
Mm-hmm.
Have you ever used alcohol?
Yes.
When did it start?
When I was 12,
When was the last time that you used?
on the way here.
On the way here, okay. When you do drink, how much do you drink?
A lot.
A lot. And what do you consider a lot?
5 or 6 mixed drinks.
5 or 6 mixed drinks?
Yeah.
Anything else?
Sometimes.
Okay. Have you ever used amphetamines such as Adderall, Concerta, Vyvanse?
No.
Have you ever used barbiturates or benzodiazepines such as Klonopin, Ativan, or Xanax?
Mm-hmm.
Mm-hmm. Does that mean yes?
Yes.
Okay. And what have you used?
All of them.
All of those. Do you have a prescription for any of those?
I have prescription for Klonopin.
You have a prescription for Klonopin. Okay.
I've had one for Ativan in the past.
And you've had one for Ativan in the past. Do you take Ativan right now?
No.
Okay. Do you take anything other than your prescribed Klonopin now?
Not for a while.
Not for a while. When was the last time that you used any of these medications?
This morning,
This morning. And what did you use this morning?
Klonopin.
You used Klonopin. And how much Klonopin did you use?
I don't know what my prescription is, but I only took one.
You only took one. Okay. Have you ever tried inhalants?
No.
Okay. Is there anything that I forgot to mention that you have used or you are currently using?
I've used cocaine, speed, but that was a long time.
And when did you use cocaine and speed?
Like 4 years ago,
Four-
maybe.
Okay. Do you or anyone in your family have a history of alcohol or drug use?
No.
Okay. I'm going to ask you a few questions, and you can feel free to say pass if you don't want to answer any of them, okay? Have you ever been a victim of abuse?
No.
Sexual abuse?
No.
Physical abuse?
Yes.
Yes. Verbal abuse or public humiliation?
Yes. Verbal abuse, but not public humiliation.
Verbal abuse, okay. Violence, including domestic violence?
Yes.
Okay. Describe any of the abuse that you have been.
Pass.
Pass. You don't want to talk about it. Okay. Have you ever been the abuser?
No.
Okay. Have you ever, by intentional or accidental, caused death or a severe injury to somebody?
No.
No. Have you committed acts of violence, such as to animals or starting fires?
No.
Do you possess or carry a weapon?
No.
Have you had any martial arts training?
Good God, no.
Are you a member of a street gang or any other kind of gang?
No.
Have you ever been in jail?
No. Well, only to visit, but never arrested.
Okay. Today we went through some really tough questions, and I asked you to talk about things that I know isn't comfortable and that you don't want to talk about. Thank you for sharing that with me. It's important for your recovery that you know what you're doing and that you are willing to let me know. You are strong just for coming and asking for help. What we're going to do now is we're going to talk about the different programs that we offer here, okay? We offer several different programs. We offer an inpatient detox. We offer a inpatient, outpatient, intense outpatient treatment clinic. The intensive outpatient treatment runs 5 days a week for 3 hours a day for 4 weeks. That we have a night program that is more designed for people who work, that they can do that 4 nights a week for 5 weeks. It's 20 sessions. We offer individual counseling. We offer a Suboxone program, and we offer an opiate recovery program. With you identifying that you currently only use alcohol, you would be best suited for our intensive outpatient treatment program. Do you think that you can make that kind of a schedule work for you?
Probably the night one.
The night one. It runs from 5:30 to 8:30 every night. During that time, you will also be asked to see a counselor 1 day a week. He or she will be assigned to you, and you can come at 4 or 4:30, 5 o'clock even, and meet with them for 30 minutes a week. Would you prefer a female or a male counselor? Doesn't matter?
Doesn't matter.
Okay. Do you have insurance?
Yes.
Okay. We do accept insurance. Can I have a copy of your insurance card?
Sure.
Okay. Thank you. We will run this, and I will let you know what your insurance covers and what your copay will be, okay? Here is my card. I want you to use that. Feel free to call me anytime. I'm here every day from 8:30 to 5, or you can leave a voicemail, and I'll be happy to help you in any way that I can, okay?
Okay.
Thank you for coming in today. You are now on the road to a clean recovery.
Thank you, Miss Janet.
You're welcome.